You're fit, you're fast, but suddenly your knee gives out. Welcome to runner's knee, the silent assassin of athletes. This video is not just for runners, but for anyone who's felt that dull ache in the front of their knee.
If you play any sport, train hard, or sit too much, this one's for you. We are going to talk about what runner's knee exactly is, why it happens, and how to fix it.
Runner's knee is the common name for Patellofemoral Pain Syndrome, and you can get it from anything that puts repeated stress on your knees. Running, squatting, climbing stairs, or even sitting too long with bent knees. What's actually happening here is that the patella or the kneecap isn't tracking properly in the groove of your femur. Instead of gliding smoothly, it rubs against the sides, irritating the surrounding tissues. And this irritation causes pain, especially around and behind the kneecap. This isn't a sudden injury. It's an overuse issue and it builds up over time. Usually, this happens because of a combination of weak hips, tight muscles, and bad movement patterns.
Or maybe you decided to double your mileage overnight, like I did once. Bad idea.
Now, let's do the step-down test to see what we're dealing with. First, stand on a step or sturdy platform with your weight on the leg you want to test. Then slowly bend your knee to lower the other heel towards the floor. Just a light tap, then come back up. Here's what to look for in this test. Pain around or behind your kneecap, your knee collapsing inward, and wobbling or loss of control. If you notice these, it could point to runner's knee. Now, before we get to the rehab, a heads up. If your knee swells, locks, or gives way, it might not be runner's knee.
It could be a meniscus tear, or a ligament injury, or even hip or back pain. See a doctor if it feels unstable or hurts despite rest.
Now let's break down how to treat runner's knee with targeted exercises which address the root causes, not just the symptoms. Improving your mobility reduces tension and helps the kneecap glide smoothly. And stretching eases pressure from your tight quadriceps and hips. First, kneel on one leg and gently push the hips forward. This stretches your quadriceps, especially important because tight quads can pull the kneecap and throw off its alignment. Then, lie on your back, cross one ankle over the opposite knee and pull it towards your chest. This targets the glutes and deep hip rotators. These muscles affect how your knee tracks when running. For this, drop your heel off a step and hold. This stretches the calf and Achilles, which helps improve ankle mobility, essential for proper knee mechanics during movement. Use a foam roller on the front of your thigh. This reduces muscle tightness in the quads and improves tissue quality, helping patella tracking. Strength builds control. Weak glutes and quads let the knee drift out of alignment, so targeted strengthening keeps movement stable and pain-free. For the single leg squat, lower down slowly on one leg. This strengthens the quads and glutes, both crucial for absorbing impact and keeping the knee aligned. For the single leg deadlift, hinge at the hips while balancing on one leg. This targets the glutes and hamstrings for posterior chain strength and joint control. Next, lie on your side with the knees bent and lift your top knee. This strengthens the gluteus medius, which is a hip stabilizer that keeps your knees from collapsing inward. For lateral band walks, step side to side with a resistance band around your legs. This trains hip abductors and builds control during sideways movement, key for dynamic sports and uneven terrain. Better form means less strain. So do drills like these to teach your body to move efficiently, keeping pressure off the kneecap. Lean onto a wall and practice high knee drives. This trains proper posture and midfoot striking, reducing excessive knee load when running. For this, skip forward with active knee lifts and arm swings. This reinforces coordination, rhythm, and hip-knee alignment during running. Then do butt kicks, but do it properly. Jog while kicking your heels up like this. Builds hamstring engagement and encourages a smoother, more efficient stride.
Runner's knee isn't just for runners. It's a wake-up call that your body needs tuning.
Mobility, strength, and better movement. That's the real fix. And catch you next time.